Today is January 27th, 2020. My name is Anthony Villanueva. I am interviewing Luis Martinez for the Latino Oral History Project, Voces of a Pandemic Project at the Center for Latino and Latin American Studies at Northern Illinois University. This project is in partnership with Voces Oral History Center at the University of Texas at Austin. Please know, Mr. Martinez, that this interview will be placed in the Northern Illinois University libraries and shared with Voces Oral History Center at the University of Texas at Austin. If there is anything you do not wish to answer or talk about, I will honor your wishes. Also, if there is something you want to talk about, please bring it up and we will talk about it. Because we are not conducting this interview in person, I need to record your consent. So I'll be asking you a series of 6 questions. Please say, yes, I agree, or no, I do not agree, after each one. There are several questions we need to make sure you agree to before we can go on. The Center for Latino and Latin American Studies wishes to archive your interview along with any other photographs or other documentation at the Northern Illinois University libraries. Northern Illinois University libraries will retain copyright of this interview and any other materials you donate to the Center for Latino and Latino American Studies at Northern Illinois University. Question number 1. Do you give the Center for Latino and Latino American Studies consent to archive your interview and your materials at the Northern Illinois University libraries?
Yes.
Question number 2, do you grant Northern Illinois University libraries the right, the title, and the interest to copyright over the interview and any materials you provide?
Yes.
Question number 3, do you agree to allow Northern Illinois University to post this interview on the internet where it may be viewed by people around the world?
Sorry, man. Stuff is stuck. I guess yes. Yes.
Question number 4, do you grant the Center for Latino and Latin American Studies consent to share your interview and your materials with Voces Oral History Center at the University of Texas at Austin for inclusion in the Voces of Pandemic Oral History mini project, which will be included in posting the interview on the internet?
Yeah.
I have many questions in the pre-interview form we have already filled out. We use that information from the pre-interview form to help in research. The entire form is kept in a secure Voces server at the University of Texas at Austin. Before Voces sends it to the Benson Library and to the NIU libraries, we would have to strip out any content information for yourself or your family members, so that will not be part of the public record. Your public file will not be accessible at the Benson Library and the NIU libraries.
Okay. Yes.
Do you wish for us to share the rest of your interview in your public file available to researchers at Benson and NIU libraries?
Yeah.
And the last question, on occasion, the Center for Latino and Latin American Studies and Voces receive requests from journalists who wish to contact our interview subjects. We only deal with legitimate news outlets. Do you give consent for us to share your phone number or your email with the journalist?
Sure. My email will be fine. Email.
Email will be fine. Okay. And that email that you referred to is the one at the Elgin Community College?
Mm-hmm.
Okay, I'll make sure I enter that in your file. That concludes the pre-interview form and the question series. Now, on a more personal note, I'm going to ask that you tell me a little bit about yourself.
Okay. Well, you know, I was born in in a small town in the East Coast, northeast coast of Venezuela, called Carúpano. I'm the fourth of four siblings, so I'm the youngest. My father worked as a pharmacy assistant for many years until he retired. My mother was a stay-at-home mom, and I grew up like any other kid in a small town, you know, playing with friends and stuff like that. And we didn't have a lot of stuff. We were, you know, we have the basic stuff at home. We were, you know, low income family, and my entire education was. I attended public education institutions from elementary to middle to high school and to university, where I got my medical degree. After getting my medical degree, I worked as a physician in both public hospitals and private practices as well. I've worked in different hospitals and private ones in different parts of the country. So that's kind of like part of my life in Venezuela in a nutshell. I came to the US, to Cleveland State University. I studied English there. I took some part of a program in healthcare administration. After that, I went back to Venezuela. I worked there as a medical director of a healthcare system for people employed by the Department of Education. And then after that, then I came to I came to the U.S. and since then I've been here in the U.S.
And, how did you come to Elgin Community College?
You know, I was teaching at Elgin Community College at that time. I was a part-time instructor, and one of my good friends there, a full-time faculty member there, told me about Elgin. That Elgin was looking for a full-time faculty member in anatomy and physiology, and I always wanted to be a full-time faculty member, but the name Elgin didn't resonate. Yeah. You know, I was like, well, okay, well, thank you. Yeah, I'll look into it. And to be honest with you, I never looked into it, like going into the web page and looking for the college. And the next time I saw the guy again at work at Wabonsi, he told me, "Did you apply?" And I told him, like, man, I don't know. I don't know. I don't know what happened with Elgin. It doesn't click. Right? And he told me, he's from Texas, and he told me, my dad always taught me that you never say no to a job that you don't have. Once you go and apply and you see the job, then you can decide, but don't. And so I put my resume and all my stuff, and at that time, you didn't submit resumes or anything online. You have to personally come and deliver your resume. And I kept calling and calling ECC for like 2 or 3 consecutive days, and nobody answered. And that was, to me, was even more like, wow, I mean, these people don't even answer telephones. And so I drove, and I had in my mind that ECC was this rundown, old, moldy building. I don't know why. Okay? But I drove and I got there, and when I got to the parking lot, there was not even a car in the parking lot. So I walk up to the building, I knock on the door, nobody opens the door, and then here comes a police car and the squad, and the police officer gets out and asks me, may I help you? I said, well, I'm here to deliver my resume. And he said, well, the school has been closed since last Saturday. We are on spring break. Well, no wonder why nobody would answer my phone calls, right? But I saw the buildings, I saw the campus. I came back when they reopened, and then the rest is history. And I've been really happy working at ECC for the last, I'm gonna say, 15 years. Been there since 2005 or 6.
So you've been at ECC for at least 15 years now.
Yeah.
And to discuss more the current events that are happening now, how did you come to learn about the COVID-19 and how it turned into a pandemic?
Well, being a physician by trade, and when I teach my classes, I try to incorporate some medical aspects into the anatomy and physiology, because anatomy and physiology is the backbone of medicine. So we study, and I like to watch the news. I admit to that. So I was following the news about what was going in China since early January, and being part of the faculty association leadership at ECC, we were constantly having conversation among the what we call the executive committee about this pandemic and how this was going to affect, school, students, faculty and staff. And so we knew one of my colleagues at the faculty association happens to have a master's degree in public health. So, me being a physician, this other colleague has a master in public health. We have nursing faculty at ECC. So we were having conversations about what is this going to look like. And so we knew that we were going to have to get ready. The way the world operates nowadays, where, traveling is just look at the number of people that normally, not now, but normally pre-COVID-19, look at the amount of people that come from overseas into the US every day to all the different main airports. And then look at the amount of people that travel within the US. So we had an idea, but I have to tell you, we never thought it was going to be this bad. We thought it was going to be, okay, yeah, it's going to come here. We remember the swine flu, the Ebola. We thought it was going to be something that could be contained, but we never really thought it was going to get this bad. But we were already by late January, early February, we were start having conversations like out of curiosity, like, is this going to impact us? How is it going to be? Some people were saying, oh yeah, this is going to be something we're gonna get it. It's gonna be like a flu. We're gonna be over. That's it.
The last thing that you were telling me about was how you and several of your colleagues knew that around February that you had all gotten together and you thought that this was going to be a little bit more serious than you had previously thought.
Yeah. So yeah, we at first we had, we had the idea that it was going to spread. What we didn't know was the severity. How many people could die. we thought that this was going to be like another, you know, thinking of other coronavirus in the past, but you know, it was so. I think we didn't have an idea of the magnitude of the severity with certain population.
Okay.
And we started telling students by early March, late February, early March, like, keep washing your hands, wash your hands, hand sanitizer if you don't have. At that time, there was no indication of the need for face mask or anything like that, but that's pretty much how we, how I became aware of.
And at what point did you consider the situation to be serious, more serious than you had previously considered?
I think it was the week of March. I'm gonna say the school. Let me double check here. I have my. I think on March 13, we have officially information that the school was closing the campus.
Right.
And during that week, the week of March 9th through the 13th, there was a lot of, meetings, conversation at the college with regards on what to do. So we, the faculty association, thought that the situation was serious enough that the college should consider just closing. And at that point, we made the case to the college that it should the college should close. That at that point, we already knew that the main way of spreading the virus was through, respiratory droplets and stuff like that. And I remember I wrote an email to the president of the college, and I told him, I'm not talking to you as a faculty member. I'm going to wear my medical hat. I think the college should seriously consider, closing, at least until we have a better idea of how to safely reopen. Because I don't know if you remember, at that time, that's when all the hand sanitizer disappeared, all the disinfecting wipes and stuff like that. So we had concerns about, well, are we going to be able to, have all these things? And the college did. The college found some supplies of hand sanitizer and disinfecting wipes. But the problem was that still, how were we going to control the spread through the respiratory droplets if you have a classroom with 24 students? And so at that point, I not only me, but some of my other colleagues in the faculty association, we knew this is going to be serious.
And when was the decision made, and by whom, to close the school?
Well, that was a decision made by the administration, and I do believe, Anthony, that was March 13th, I believe.
Mm-hmm.
Yeah, I believe it was March 13th. That was a Friday.
Okay.
Yeah.
To change course a little bit, do you know of anyone who contracted the COVID-19 virus?
From work, no.
Family-wise? Family-wise?
No, I don't know. I know a friend of a friend, but it's not a friend of mine. So this is my friend knows somebody who had, but I know, you know, I've been lucky that nobody in my immediate circle.
And your family in Venezuela?
None of them. None of them. No.
And do you feel as an educator that the way the COVID-19 progressed here in the Kane County area, did it make an impact on education?
Yeah, oh, definitely. I mean, you know, we were in the spring semester of this year. We were teaching our regular classes, what we call face-to-face. The students are in the classroom or in the lab with the instructor. We're doing all that stuff. Students had registered for that kind of class, what we call a face-to-face class. Comes March 13, the school closes for 2 weeks at least, I think, if I remember. The week following March 13, there was no instruction, nothing, not even through the internet, nothing. Then came, after that, the second week of closing, that was spring break. So you don't teach during spring break. And then the week after spring break, there was no instruction either. We were just trying to figure out how we're going to do this, how we're going to complete teaching this semester to finish it. And we were by necessity, we switched into online teaching. So if you have never taught online, that's not easy, okay? And then you have students that I didn't register for an online class. I've never taken an online class, and now I am here trying to finish my English 101 online when I was in the classroom 3 weeks ago. So that impacted in a big way. And some students didn't have another option but to drop the class because they were not, I mean, you have students, you may have somebody who is not computer savvy. You may have a student that doesn't know what is to do, you know, like a Zoom or anything like that. And and so they were, you know, in a very tough situation. Faculty as well, because not every single faculty member at ECC has taught online before. And in order to teach online, you have to get some training. And out of necessity, you know, we had two options. We canceled the semester and then students would lose what they were trying to achieve that semester, or we try to, you know, do the best we can and just move online. And that was a big shock for students and for faculty as well. So it definitely affected the way, because it's not the same if you are told, okay, if you are told in May, okay, prepare because in August, all classes are going to be online. So you have May, June, July, August, part of August to learn how to teach online, take some online training. The college could provide some training. But at that moment in April, I've never thought, I thought hybrid, but never online. And maybe I wasn't in a bad shape because at least I had taught hybrid for 10 years. But how about the one that had never taught online, and then you're thrown into that situation where, okay, you have to finish the semester, you have to teach all these online. So it did affect, it did. But we had no other option. The other option was cancel everything, and then what?
And did you learn of any faculty members that or employees of the college that lost employment?
No,
No.
nobody.
And
In that sense, Tony, the college has made all efforts. The administration has made all efforts to keep people employed, because I think they realized this pandemic was not something that was, it's not, nobody at the college has responsibility for the situation. So
and as a medical physician and as an educator, what do you think the emotional impact of this COVID-19 is on the present students and in the future? What do you think will derive from this?
Well, I can tell you, Tony, as you know, many of my students are either going to or already in the health professions programs. Some of them may be going to surgical tech, some of them may be going to nursing, to radiography, and some of the students are already working in medical offices, hospitals as CNAs, and I had many students during during March, April, May, at least the hardest month of the pandemic here in Illinois, that they were working. They used to have a work schedule. Okay, you work Monday through Friday from 3 p.m. to 11 p.m. And with the pandemic, they were called to work, and they were working very long hours, sometimes the whole 12 hours. And a lot of my students were having a very hard time being able to complete their assignments, being able to work, especially at those working at hospitals or medical facilities, and then having to go home and deal with their families. Because, you go to the hospital and you're taking care of COVID-19 patients, and in the back of your mind is always, did I catch it today while I was taking care of this particular patient? And now I'm going home. And am I carrying this stuff home to my family, and so on and so forth. So it was very stressful for students. And I'm sure, my two kids, they don't work in hospitals, but if I were married and my wife was a nurse and she had to go to the hospital and take care of COVID-19 patients and then come back home, no matter how much PPE you put in yourself and all that, there is always that thing in the back of your head, like, the back of your mind, like, did I catch it today? Because we have seen how many nurses and physicians and others in the health profession have lost their life to COVID-19. So I'm 100% certain that, especially during those months, my students were really, really struggling to keep up with everything.
I'm going to ask you to take off your doctor's cap and gown, and I'm going to ask you to take off your educator's cap And I'm going to ask you on a personal note, how has this COVID affected you personally in your day-to-day transactions?
Um, Personally, it's not easy for me to be inside these four walls here for most of the time. Interestingly enough, on March 13, I went to see my doctor because I started having the night before, I started feeling some kind of like what it could be called some kind of asthma symptoms.
Right.
So I went to see my doctor, and he told me, no, this is not the virus. He put me on a nebulizer while I was in his office. He sent me home. He said, I didn't know at that time if the school was going to continue to work or if they were going to close. And he said, well, just take it easy for the next 4 or 5 days, stay home. And I've been dealing with that since March 13th. So for me, that is kind of like an underlying condition that I have. Something.
Right.
When I was a kid, I had some asthma, and then that thing went away, and so. But I work in an environment where, and you know this very well, where we deal with formaldehyde every day. So, but so that thing, it's been bothering me throughout these last 3 months. It's not like I'm gasping for air, but it feels like I have something. Sometimes I even make like a whistle sound in my chest.
Okay.
And then also right here in my larynx, my vocal cords, they sometimes get, it feels like they get swollen. Well, so that has put a little bit more stress on me. So if I have to go out, I'm very careful. I have most of my shopping, I have done it through online services that I get. I have a good friend of mine who works for Instacart.
Right.
Very good friend of mine. So she has offered to do grocery shopping for me and stuff, and I appreciate that. My kids too, they help. And but a good thing, I got an X-ray done on Monday, and everything was fine. And now my doctor said, okay, now let's check your vocal cords, your larynx, and so I'm going to see an ENT doctor.
Mm-hmm.
But it's been heavy on me because I'm here. I mean, I go out and walk around the block. I try to, I ride a motorcycle, and I went out once for a half hour, and I did it because I can't have a motorcycle sitting there for a whole year. It's been sitting there since October of last year, and the engine is going to, it will be, it could cause some problems. So, but other than that, I'm trying to, stay busy teaching in the summer. I'm teaching 3 sections of 246 in the summer, so I'm, trying to read and do stuff. One of my biggest concern, because we are all humans, obviously, is that my 2 kids, they are well off. They are both graduated from college. They both have jobs, and they are married. And my family in Venezuela is my biggest concern, because the situation in Venezuela, both financially and politically, it's very difficult. And I am the sole provider for my mother. So I provide financially for her so that she can have whatever she needs, medication, food, this and that. I'm sorry, Tony, hold on one second. Oh, again. Give me one second, Tony. Hold on. I'll be back. Hold on, I'm going to answer.
Sure.
Okay, Tony. So I'm the sole provider for my mother. My mother lives with my sister. My sister is a retired high school teacher, English high school teacher.
Right.
But with the situation in Venezuela, her pension, she gets paid $4 a month. So you can imagine.
Oh.
That's nothing. So
Right.
my concern has always been, you know, if something were to happen to me, that's my main concern is my mother and my sister, because I monthly I send them money and I wire them money, and sometimes I send them dry goods from here because food there is very expensive. So that it's been stressful, yeah. But you know, the only thing I can do is just, you know, keep on going every day, just trying to do my best to stay healthy. And
Is there? I want to thank you. Thank you for taking out the time
oh, my pleasure.
to share this information with us. And is there anything else you would like to share about your experiences that I haven't mentioned, that I haven't asked you?
Well, you know, I don't know if this is something that's gonna be, you know, relevant to your project, but you know, I get, as an educator, as a physician, just as a citizen, I wonder why is it that we in America cannot have a response to this virus in a way that is effective as other places like in Europe have done? Because I remember March, April, Italy, Spain. Oh my God, you know, that was the epicenter. It was so bad. People were dying left and right. And now look at where we are right now. Now, when you look at the entire European Union, their average daily number of cases in the European Union, and here we are at 20,000 a day, and going up. So I wonder, why is it that we don't complain when we were told you have to wear a seatbelt? We didn't complain about that. When we were told that you have to have driver's insurance, we didn't complain about that. But no, now we complain about social distancing, we complain about wearing a mask, we complain about this and that, when we know that it works and it has worked in other places. And even when you look at, you know, when you look at this, the demographic spectrum of the United States, Black and brown people are hit the hardest by this virus. And I don't know what is in the mind of those that refuse to understand that this is not a political issue. This is not a left or right. This is not a red, blue, gray. This is a public health crisis, and it should be addressed based on that. When you look at brown people, and when you look at Black people, I mean, those are the ones that have the largest number of people not covered by insurance. And when you go to the predominantly black and brown neighborhoods across Chicago, that's not where you find the best hospitals in the city. And so that, I mean, I cannot wrap my head around as a physician, as an educator, and as a citizen, as to why is that we cannot come to some sense of agreement and say, hey, you know what? Yeah, I heard somebody saying the other day, well, you know, when you wear a mask, you force me to breathe CO2 and blah, blah, blah. And I'm like, wait a minute, I work in operating rooms for years and I had to wear a mask. And there was never an indication, scientific indication, that we shouldn't wear a mask when we were performing surgery, because we were going to be breathing some CO2 or some stuff, some of this. And so, I don't know, I think there is a lot of selfishness in the way people are seeing this pandemic, and individuals, you know, individuals that demand that, you know, I will not do this. I think they are not looking at the greater good, and we are being selfish sometimes. So if I were to have an opportunity right now as an instructor to have a conversation with my students, I will tell them that. I will tell them exactly what I just told you. You know, that we need to. Sometimes, you know, okay, so if you are a patient, you are coming into the OR, you're going to have some surgery, we're going to open your abdomen wide open, and everybody in the OR is not wearing a mask, what would you say? Would you be comfortable? Probably not. So, but thank you, Tony. I'm happy I was able. I hope that my answers are of any help, and then if there is something that you know, if you need to ask any additional questions.
When I get the transcript, I'll go over it and probably go over it with you to make sure that everything is the way we intended.
Anthony, I don't know if you want to. This is totally unrelated to your project. So if you need the recording to be just about your project and you want to stop recording it now, that's fine. But it's not related to NIU or anything like that. So
no, then I'm going to stop it then.